Hello, geeks. This is Brian Kui from medicalcodinggeek.com. And today I am going to do another mentoring session with a student. But unfortunately, the student was not able to make this call because she works. So I know most students who undergo schooling for medical coding or health information technology also go to school also work as well, and I did that when I went to school as well. So all right, so this is, let me give you the scenario here. I believe this was Thursday or Friday. It was Thursday. So this on Thursday, the student reached out to me. Her name is Marilee. So Marilee, this video is for you. She came in and messaged me on my Facebook page, Medical Coding Geek, on Facebook. She said, "Hello, I'm currently in my first semester for my associates for medical coding. And this week we were assigned to come up with 15 questions to ask a professional in the field. I asked another group and one said yes, but has since ignored me. Can anybody help with this?" So I guess I run into this a lot where people try to get professionals, but unfortunately professionals cannot help them. Let me start off by saying this before I start answering some of the questions. I mean, what's going on with you guys with the profession? What is going on with the professionals in trying to help our students out? I think this message is for the professionals to step up and help your students. I don't. I don't. It shouldn't be a concern of competition. I mean, that's one thing that that comes to mind as a reason why we don't help our young professionals is the worry of losing jobs or increasing competition. No, when you think of the industry, we need to strengthen it. And if somebody's asking you for help, and in this instance, you agreed and you ghost the student, I don't know. That's one thing that's happened to me as a professional, where people say they will do something and they don't, and then when you're trying to reach out, they don't respond. Where's the professionalism in all of that? Anyways, so I have, or Marilee gave me 15 questions. Unfortunately, she could not make it today. So I am going to do a recording of answering these questions that she came up with. I might have to clarify some of the questions that she has created based on how it's written. Because she's not here, I would love to have her on so that way we can kind of go over some of the answers. And because I'm giving the answers, I would love to hear her feedback on those questions. That's the reason why I wanted her on. But because of it's a short time notice. Today is Saturday. Her assignment is due tomorrow night. And whoever was supposed to help her out really put her in the bind. So I'm trying to get her out of that bind here. So let's get to the questions. I'm going to show you guys here 15 questions. I'm going to start off with the first 7. Okay. And I am going to navigate through this software and answer these questions. So question number 1. What would you do if the patient file was unclear? Now, the first thing that comes to mind when I hear patient file, there's 2 types of, I guess, files per se. One of them is the administrative file for the patient. The other one is the medical file for the patient. So I am wondering which one is that. Is it an administrative file, meaning that the patient's name, demographics, location, insurance information, is that what you're talking about? or are you talking about the medical file that has the clinical information, the medical records? Okay. But to answer either way, if either is unclear for the patient file, the administrative file, there has to be a clarification process in order for you to, I guess, create an account for a patient. Like if you're trying to create an account with the patient's name, insurance, date of birth, etc., anything in terms of demographic data, you want to make sure that you are clarifying that. You want to make sure that you are, as a registration person, you want to make sure that you're verifying it as you're going along. Because the problem is that if you don't verify the patient's information as soon as they come into the office, to the ER, to the hospital, then you're going to have data that is really spread out, meaning that you might have one patient with two sets of data. And that creates problems because when you create one patient with two sets of files, then you have two sets of medical records. And then when they come back to the hospital, then you have to refer back to two versus one. You get what I'm saying? Like it's hard to if one piece of information of the medical history is on one file and another piece of medical history is on another file, you risk the patient's safety. You risk the patient's quality of care because information is spread out. All right. So for the patient file, socioeconomic, administrative data, administrative file, this needs to be caught up front. Now, if it's not caught up front, well, then it's up to whoever is reviewing that file to catch, hey, this is wrong. We need to correct it. So it needs to go back to the beginning where it should have been corrected and made correct in the first place and get it corrected. I've seen instances where we have one patient, two files of information where they require to have that information merged. So in hospitals and health information management departments, there are merging functions. Okay. On the other side of the coin, if the patient's medical file, the clinical information, the physician documentation is unclear, then this would require what's called a query. And a query is basically a question to the physician based upon information that may not be clear to the reviewer, to the medical coder, to the CDI, to the nurse, to another physician. And so you would have to place a query or ask the physician to clarify the documentation. In this instance, it's called clinical documentation integrity. I've done it for about 12 years. And that's how you would really clarify any misinformation or any unclear documentation by the physician. So that is numero uno. Let's get into number two. So number two is, what are the main skills that you think a successful coder must possess? Main skills. So if you refer back to the previous mentorship, I highly suggest you do. I have already answered that question, but I will answer this question for you. Main skills for a successful coder. I think the keyword that you've put in there is successful. And in my last mentoring session, the skill that I feel that would make a successful coder is understanding your clinical skills. And you are taking let me go back. I believe it is your associates for medical coding. So as part of your program, there should be some form of clinical class, medical science class, clinical foundations class that you are receiving. You want to make sure you get the the best bang for your buck for that class. You really want to focus your attention, question that course, challenge yourself in that course, because without clinical skills, without understanding the medical process. You cannot be a successful medical coder. The medical coding part is the easy part, but if you cannot understand what you're coding, the medical or the clinical process, then you are going to struggle. Medical coding processes and guidelines are, to me, they're difficult. They're easy, but yet difficult because you need to practice them. But understanding your clinical and medical skills and knowledge goes a long way. Another skill that I think you need to be possessed. You need to possess as a medical coder, a successful one, is the ability to abstract information. I don't think I mentioned that in the previous mentoring session, but when you are reviewing medical records, it's your ability to look over massive amounts of data and to abstract out vital pieces of information for you to assign a medical code, to get an understanding of what's happening to the patient. And this happens to develop over time. You're not gonna, there's a difference between reading a line versus reading a full paragraph, reading a full page. And you, as a medical coder with productivity requirements for your job, you need to be able to scan that record and be able to abstract out pieces of information, then take that information and come up with the decision and understanding, utilizing your skill of clinical skills and medical skills, and understanding to put it all together and say, hey, that should be assigned as a code. Okay. Another skill that I think a medical coder should possess is communication skills. You're not going to be taught that in school, but to the fact that I'm going to tell you the truth, you just wanted me to answer these questions, just type them out and send them to you. It shows to me that there is a need for me to intervene here to promote your communication skills. Not in the typing sense, not in the chatting sense, but in the sense that you need to connect with a professional and communicate verbally, on camera, in person, over the phone, whatever it may be. We cannot do electronic communication. If you're going to be a successful professional medical coder, you need to possess really good communication skills. And I think for students, the first step in achieving being successful with communication is to break out and reach out, which you did, which I give you kudos for that. The next step after that, which I'm giving you, is let's get on a Zoom call. Let's get on a call. Let's get on something so that way we can, talk about this on camera, so that way you can practice. Because if you practice with me, you can practice with everybody else, and it will help develop your network. All right, let's get to number 3. Number 3, what are some tips you can give a new medical coder who is just starting out? And I think it goes back to my last topic is networking, right? So if you are starting out, I'm assuming when you say start out, you just completed your associates, okay? You just got your certification. And I think the underlying question is, well, how do I get a job? I think this is the question I'm reading in between the lines here. Is that how do I get a job? All right. So again, you did the first step is you reached out to me. But don't just reach out to me, reach out to other people, what you've done. But unfortunately, you had a bad taste in your mouth with that person ghosting you. That's not good. But it does happen. I'll let you know that it does happen a lot. So when you are faced in that situation, you need to just, get up and move on. Hey, it happens. But you'll find people out there that are willing to help you, like myself. So education, certification, to me, the next thing is networking. Network with professionals. You want to investigate out the field. You want to feel out the field. You want to do a reconnaissance of the field in your area by reaching out to professionals. You can do that with your local AAPC chapter. You could do that with your local AHIMA region. You can go into your state. You're using, I don't know, you used Facebook. So Facebook is good, but also LinkedIn is great. So you want to reach out to professionals out there that you look up to. Reach out to them. Let them know, hey, I am very interested in you. Is there a time that we can talk? And at least a few minutes of your time to give me some insight. Maybe there might be a pressing question, just one question that maybe that person can answer for you over the phone, in person, on a Zoom call. Do it. Okay. Doing it over a chat, it won't catch the eye of the professional. I get chat messages all the time, and names just fly over me. The ones that I remember the most are the ones that have reached out to me and got on a Zoom call, and we do like a 1 to 2 to 3 hour session of discussion. So it's ingrained in my mind for remembering that person. Okay. Yeah, network. Just continue to network, and then apply to positions that you are qualified for on a entry level. It doesn't necessarily have to be a medical coding position. You can work on a parallel with other positions such as registration, patient accounts, front office. I used to work in medical records. I used to be a medical records file clerk. I used to be a radiology office film librarian. Okay, before doing all of that. And I think what's important is even though I'm not performing a medical coding function, what you want to do is get an insight on how the organizational structure of that healthcare institution, that office, is working. And so you want to relate where you are at in your current position and how it relates from the bottom up to administration. Okay. So that is question number 3, really quick. Now let's move on to question number 4. How many charts can you code in an hour? Well, to give you a bit of insight, I used to work as a CDI specialist back in 2006. I did it for 12 years. I did spend some time working as an inpatient coder, just cross-training for about a year. And now I'm currently an auditor, okay? So charts per hour depends on a couple things. How big is the chart? What kind of codes are you assigning? What is it exactly that you're doing with the codes to code that chart? And there's many different levels of functions, different levels of, I guess, of functions and duty and job requirements that you need to do as a medical coder. To be a medical coder, let me give you some numbers. I know for when I was doing inpatient, I know I was doing, depends how big it is, but I know I was doing like 40, 50, at some point 60 inpatient charts for the day over 8 hours with a half an hour break. So that's about 7.5 hours. So do the math. About 40 to 60 in about 7.5 hours. Let me do that math for you. Hold on. Let me do it. Okay. So that math is about, let's just say 60 divided by 7.5. It's about 8 charts an hour. Okay. For inpatient, because it's you're talking about days of hospitalization by the patient that you have to deal with. And it could range from about 2 days to about 30 days. So that's what I was doing on a daily basis. For CDI, I was doing about 10 to 15 new cases and about 20 to 30 follow-up cases, depending on what I need to follow up on. So when I say CDI, I'm talking about clinical documentation integrity. It's a new buzzword. in the medical coding community, CDI, but I'm not going to talk about that. But as a CDI specialist, um, 10 to 12, 10 to 15 new cases, and about 20 to 30 follow up cases per day for about 7.5 hours. Okay. In my auditing job, uh, I can do about 20 charts in a day because I'm auditing records and then I'm writing letters based upon my findings as an auditor. So that is about, let's see. So I can do about 20, but to be comfortable, I usually do, my number is at 17. So after 17, my brain gets a bit foggy. I'm kind of aging, aging here. I used to just do a lot and then I'm fine. But 17, after 17, I have a bit of brain fatigue. So 17 divided by 7.5 is about two to three charts an hour as an auditor. Because remember, you're reviewing the full comprehensive medical record as an auditor, doing inpatient, just by the way. And then you are writing up a report on that case. You want to make sure that you're applying everything in terms of guidelines and policies and procedures, etc. So it requires a little bit more than just reviewing and assigning codes. So about 2 to 3 hours for an auditor as an inpatient DRG validation auditor. So keep that in mind. So most of my charts per hour has been inpatient. And it varies. So about 8 for inpatient, 2 to 3 as an auditor. I'm not too sure what the number was for CDI. Let's get into number 5. So number 5, why did you choose this career? To tell you the truth, I didn't really choose the career. It kind of fell in my lap, as most people would say. The story goes is that I was all over the place. I was a physical therapy major, pre-med major, nursing major. I wanted to do medical science and do laboratory and pathology. And unfortunately, that program was closed because I qualified for it and then the program closed. And that's how I fell into health information management, not necessarily medical coding. And I was really interested in the technology aspect because there was a formula that was healthcare plus technology equals success. And my main objective in going into health information management was to deal with the electronic health record, that process of getting it into there. Because at the time, in 2002, 2003, that's where we were trying to transition, going from a paper-based chart to an electronic medical record. To tell you the truth, when I finished college, I didn't want to do medical coding at all. Hell no. It's something that I just didn't have a passion for after I took the classes, even though my professor was totally awesome, Professor Alton Cust. It wasn't until that an employer actually reached out to me. I used to work for this employer for this healthcare system. They actually reached out to me. Noticed that I had an RHIA, a Registered Health Information Administrator credential, and they asked me if I wanted to do or be a CDI specialist, apply for it. And I said, okay. And I got hired, and that was my first exposure to medical coding. And so my first exposure to medical coding was, really a tough uphill battle because I had very basic coding knowledge. I had zero clinical knowledge, and I had to start from the bottom. And that was fortunate for me because I had been trained by great medical coders with over 35 years of experience. I've worked with nurses from all specialties. I've worked with physicians from all specialties as well. And that helped me grow into the medical coding professional that I am today. So it wasn't that I chose it. It was just presented to me. And I said, okay, why not? What's the worst that can happen? So, going back to number 3 or the third question, even though you're not presented with a medical coding position. Because for me, I thought I would get into more health information technology, the IT role, but that never manifested. I was presented with something else. Instead of health information technology, I was presented with clinical documentation integrity, medical coding, and even though I didn't want to do it, I took it and I ran with it. I struggled with it. I worked with it, and look where I am today. So, just to say that even though medical coding is your passion, you might find something parallel to that based upon the education that you receive in your associate's program. Let's get it to number 6. Number 6, what method do you use to ensure that you enter data quickly and correctly? What method? Okay, I think I get that question. So, enter data quickly and correctly. One thing that you are missing is the abstracting part. Abstracting, entering. What is it? Knowing what you need to enter and then entering it. To answer that question number 6, I'm going to parallel that with playing piano. If you've played piano or if you played an instrument, the one method that I knew that worked well for me is to start slow. Start very slow. Enter your data slowly. Get in a pattern. Develop a system of abstracting and entering, understanding when you're entering things, there are certain things that you enter that may be entered in another chart. So, certain codes, certain phrases, certain words you will use frequently, and you will develop a system to be proficient and quick in typing those specific codes, words, phrases, whatever it may be. And as you progress and progress, you slowly pick up the tempo, right? Because if you go too fast, your quality will go down. So that means the correctness, the quality, is you need to maintain that. But in order for you to get a good quality and get good speed, you need to start off slow. And so as you go for a certain speed, you check how correctly or your quality score, if it's good, take it to the next level. Let's pick it up a notch with speed. And then when you check to see that your quality is good, well, let's take it up the next step. Okay. And if it's not so good, then maybe you might want to slow down. And if once you reach a good quality score with that certain speed, you increase the speed again. So that's the process that I would understand you trying to ask me. With anything in life, start off slow. When you are proficient at that speed, at that skill, then you challenge yourself a little bit more. Check to see where you're at. If you're good, are you compromising anything? And doing things correctly is what you don't want to compromise. Because if you're gonna go too quick and just make a bunch of mistakes, well, what was the point of all of that? All of that work goes to waste because you're just trying to achieve being quick, being productive. Let's get into number 7. Okay. How do you prioritize your work when entering billing codes? And I'm assuming you're also talking about medical codes for the patient. Okay. So this will translate into number 6, what I mentioned with systems. Now, I'm not talking about systems that are implemented by your job. It's your own personal working system on how you do your job. Okay. And how I would prioritize, I prioritize differently. It also depends on the day. So when you're saying prioritize, at least for my day as an auditor, do I want to get easier cases out of the way, or do I want to get more difficult cases? When I say difficult cases, these are cases that have multiple days and multiple pages. You're talking about thousands and thousands and thousands of pages with a patient who has lots and lots of medical codes that I need to audit for. Okay. So if I know that that record is going to take a lot of time, I want to start my day fresh with that difficult chart and move and just get it over with. Okay. And then move on to less difficult charts. And then I want to end on easier charts because my brain is already done. So I prioritize based upon the time that it takes to do one chart. Okay. It doesn't necessarily have to deal with entering codes. It's entering codes for an account and how long it will take you to complete that specific account or medical record. Prioritizing in terms of prioritizing billing or medical codes, if you're working with a specific computer system, computer software, computer app, as we call it today, it's whatever the field asks for first. So if it asks for a principal diagnosis first, that's where you got to work off, and then you got to go to your secondary diagnoses, your procedures, etc. May it be your first listed and other diagnoses, it may be your admission diagnosis first, and then you work your way through whatever the first thing that comes into the field in your actual application, your working application. So it all depends, but I like to do difficult things first and then go easier. Or I don't really work with billing codes because I am not a medical biller, but I'm assuming you have to prioritize your day depending, because it's billing. There is a time requirement on sending out bills for pay, so you want to make sure that your cash flow is coming in. So there is also a time constraint, which bills need to be sent out, because if they're not sent out in time, then you're potentially losing the ability to receive your reimbursement in a timely manner. Okay. All right. So that's the first 7 questions. Let's get on to the next 7 questions. Okay. So I'm going to show them to you here. Let's get on to number 8. I've heard that it is hard to find employment in this field without experience. How did you get your foot into the door? This would probably go back to question number 3. I'm tying that question in with number 8. What are some tips? Okay. So that probably answers that question. Okay. But how do you get your foot in the door? Network, right? As I already explained, that it's hard to find employment if you are limited in the area that you want to work in. The ability to find employment expands when you have the ability to move around, right? If you're willing to relocate. Remote is an option, okay, but remote requires, at least for me, a level of expertise to do the job. Because if I'm trying to hire a remote worker, I want to know that that person can do the job, okay. But I think that has changed a lot because of the use of communication technology and the fact that we can do things remotely. And as long as that employer has a good educational component, a good educational department that provides training, go for it. So how did I get my foot in the door? It really, my situation was unique because it was just presented to me, and it was the opportunities that were presented to me were opportunities that I didn't really want. I wasn't looking for it. It just came to me, and I said, well, okay, it looks great. What's the worst that can happen? And I took it. Okay. So one best words of advice that I can give, and I've given it to a recent graduate, where she was so honed in on getting a data analytics position, and she was applying everywhere. And I told her, look, relax. Don't look for the position. Let the position look for you. Let the opportunities come to you. Okay. As I think when you chase it, it kind of runs away, the opportunity. But if you're not looking for it, the opportunity tends to come to you. So I say, apply, But keep your options open. I think that's very important. When you keep your options open, then the opportunities will come to you, even though it's a position that you may not want. But even though, let's say, the pay is great, the opportunity to grow is great, the fact that they're able to teach you and train you, I think, is a plus, right? Is a plus if they're willing to train you, because people that don't hire new coders, or employers that don't hire new coders, the reason is that they don't have an educational component that would allow them to teach new coders, to bring them into the company and put them, train them to be a productive medical coder. Okay. So look for companies that have the ability to train, to have good training components in their company. I think that's how you would get the foot in the door. But apply to places that you think are very parallel to what you do. Take a look at your skills and see what you do, and do a research and find parallels in different positions that you would qualify for. And that's how you get a foot in the door. Once you get your foot in the door, then understand the process, understand the organization of the area. And if you're still into medical coding, then get into it. Ask for it. Network. Go find the people that work in that department and network with them and develop a relationship with them. And then when an opening comes up, which most people in the profession, that's what happens to them, then they get into a medical coding position and they're in it, and then they move their way through. So that's number 8. Let's look at, whoa, you went from 8 to 10. So I guess there's only 14 questions, right? Okay, so there's no 9. Let's let's get to 10. Are there coding transcriptionist jobs? That's an interesting question. Coding transcriptionist? No. Medical coding is one job function. Being a medical transcriptionist is another job. Now, let me step back. There is no title called coding transcriptionist, but you can be let's say, an office worker, or an employer, or an employee that has 2 job functions. You can perform the jobs as a medical coder, and if they need you, then they train you, you can do medical transcription. You can do both, but there is no title called a coding transcriptionist job. You can do either one or the other. What is the most memorable error in coding that you've caught? I don't know about that question. An error. Ugh. I don't, the thing is, well, there's nothing memorable. I'm going to answer this question, but not really to answer this question. There's nothing memorable about my errors, right? There wasn't one that, and most errors, somebody else caught. It's never that I catch it. All right. Because it's an error if you didn't catch it, right? If you caught it, then it's not an error, right? Technically saying, if you caught the error, if you caught the mistake, it's not really an error unless it's reported as such and then caught as an error. I think that's how I'm trying to understand that. But to answer that question, I'm going to answer it in a way about error. So if I make a lot of errors. I've made a lot of errors in my career. I've made a lot of mistakes in my career. I've made a lot of mistakes in life. Hey, that's life, right? But what I've been able to do is learn from them fast. Because if you make an error, what happens? It gets to your supervisor or team leader. And the only way I'm presented with errors is by somebody else. It's never when I catch it. And it's presented to me and they say, hey, you made a mistake. And I'm like, oh, okay. Um, can you kind of walk me through that process as to why you made an error? And it's usually because I'm, again, going too fast, right? Going back to your how do you enter data quickly, is either I was going too fast, or I may not have known about a certain aspect in assigning that code or assigning something that has caused that error. That's something that may have happened. Or maybe I just didn't see it, just oversight. I just didn't see it and I didn't catch it, right? So those are the most three, the most error, the kinds of errors that I've made. Um, but when I get caught with an error, there's always an educational component. I need to educate myself about it, right? If it is just straight error, like I missed it, I always have to remind myself, and it's always good to write notes, but I always take mental note about things in making an error. If and I think it really comes down to focus. If you're not focused enough to do the job, then you need to just kind of back off a little bit and get back in. So I'm aging here. I'm over 40. My focus is going down. My attention to detail is I mean, it's good, but I can notice it getting, it's declining a bit. So I have to do things to keep myself really focused. Not doing so much, trying to relax, get good sleep, etc. But one of the things is focus. Stay focused so that way you don't get the error. When you get the error, educate yourself and then stay focused to prevent that error. Is there anything memorable? No, because it just goes out the window for me when I get the error, because I just don't want it to happen again. I've been written up for making a mistake, not necessarily in coding, but like with my medical record function, where I couldn't find a medical record and it was found somewhere else, but I didn't do a good job of finding it per se. Uh, that's something that I get written up for. Um, what else? But it's just mostly small stuff that get caught. It's nothing memorable about it to me. So unfortunately, I really can't answer that question for you, but I can answer it in such a way that if you make an error, learn from the error and stay focused. Let's get to the question number 12, 11, whatever. The next question. What kind of books should I always have on hand in my personal library that will help me with my career? Okay. So let me go over here. So I'm pulling from my library here because there are two books that I've kept since I graduated with my bachelor's in health and information management. But to answer your question, let's see. Books should you always have on hand? It's not so much books. I think it's just more resources now, because everything is saved on the internet. One thing that I save are regulatory websites like CMS. Uh, I always follow the OIG, the Office of Inspector General. I think the resources that you need to have is really good websites. Becker's, ICD-10 Monitor, AAPC, AHIMA. There are also great consulting websites that are out there that provide some news. Fill your email with good resources. But email is kind of like really old. So social media is great. Twitter is good for business. LinkedIn is great as well for resources. But to answer your question on books, let me show you one book that I've kept. Is this book. Okay. A Health Information Management of a Strategic Resource, second edition. This is a really old book going back to 2002. Jeez. This is over 20 years old, but I keep the book because it's just a constant reminder for me that if I'm ever in a position that I don't know what to do, I need to sit down and relax and go back to my basics, right? So I have always kept this. I don't use it now, but this was a lifesaver for me when I was a medical records director for a jail system, and I was a bit overwhelmed. And I said, "Oh my goodness, I think I know what I need to do, but I need more details on how to do it." And so I went to my office and I locked myself and I kind of went over this book as I was doing my job. Okay. The next book that I have here is this one here, Improving Quality: A Guide to Effective Programs. This book was great because not really the book, but the class was great because it helped me question things. When you receive information, you have to scrutinize it, and that's something that has always carried me through, even now as an auditor. Uh, you have to, even though you receive information, and social media is not your great source of information, but even if you get that information from social media or anywhere else, you want to do your due diligence and do your research. I'm sorry, and don't rely on that source. Consider that like a second hand or third hand source. You want to get to the primary source. Oh, that's your objective in trying to receive information. It always has to be from the primary source. So those are my two books that I always have on hand, but everything else has always been internet based. Number 13, what was your most favorable place to work as a medical coder? Um, my most favorable place has always been in the hospital. I worked for a healthcare system, but I had the opportunity to work in all of the hospitals within the healthcare system. There was about five, but the most memorable was the one that um, had a lot of specialties. I worked for a level one trauma unit, right? So I was exposed to trauma cases, trauma ICU, neuro ICU. This hospital also had a cardiac center. So I was exposed to open heart, bypass, cardiac catheterizations, pacemaker, defibrillators. Any type of cardiac condition or procedure, I probably had exposure to it. I've also worked that hospital system also had a pediatric unit. So even though that's not really my specialty per se, but I've had exposure to it. I've exposure to psychiatric, newborns, moms, oncology, orthoneuro, right? Since it was trauma, I've dealt with that, medical surge, um, critical care, ICU. So there was that one hospital is over 700 bed facility. So, it was great because I had exposure to a lot of specialties and it helped me grow as a medical coder. All right, next question. When you were in school, oh geez, that's about that's many years ago, 20 years ago. What was your best study trick that you had learned? Best study trick. Um, as a student, study trick is I really have to think about that. Gosh, you're telling me how did I study? Well, the way I studied in school was in pieces. I never studied um where I never studied in long segments. I always studied in shorter segments. So what I did is I broke my study material into sections. Okay. And whatever I needed to study for, I would take that one section, I would study it. Okay. And then I would take a break. Then I would come back and study the next section, take a break, and then do the next section. What I did during the break, though, even though I was relaxing, is more contemplating what I studied, right? Thinking about, pondering, like, what did I just read? I'm not really, intensive. When you think of study, you're trying to absorb, right? But when you take a break, you are contemplating. What did I just read? Does it make sense? What best scenarios could come up with in an exam question, etc. So I really contemplate. But if I had a study, it was always in pieces. But one best words of advice that um, another student who just graduated, Erica, she said to make a schedule. So always schedule yourself in terms of studying. Another study trick that I've seen is study cards. That's great, but it's great because it helps you learn in segments. Never take a book and then flip through the book. Always take a piece of information, put it on a study card, and just learn that piece of information until you're proficient. Then move on to the next. Then move on to the next. Um, don't take, don't take a bite of something that you really can't take a bite out of. Just like what was the analogy? Don't take the best way to eat an elephant is one bite at a time. I think that's the advice that I was given. So that's number 14. All right, let's get to the 14, right? Let's get to the last question. The last question, I'm gonna pull it up here, is what extra credentials did you get, if any, and why? All right, so I have my RHIA, which is a Registered Health Information Administrator credential, brought to you by the American Health Information Management Association. The next credential that I got because I was a CDI specialist was the CDIP, Clinical Documentation Improvement Practitioner. It wasn't really required, but I got it because I was a CDI specialist and I just wanted to get a leg up in the industry. Have I gotten any other certification? Well, the next certification that I would think of considering is the CCS. But in my role, even though they asked for it, it would help. Um, I've been maybe I'm tired of getting certifications, but there are people who get certifications upon certifications upon certifications, just as a testament of themselves, right? For their own personal gain, not necessarily for their profession. It's just, hey, I got a credential, I'm proficient in it. I did it, right? It's like a medal. But for me, just the process of getting that credential is a lot, and I feel I only need credentials based upon what I do. So the CCS, the Certified Coding Specialist by AHIMA, is something that I would consider. Other ones that I would really, I guess, entertain the fact of thinking about getting is the CDEO by AAPC. There's also the CDEI by AAPC. There's also the CRC. The last two the credentials that I talked about were more CDI credentials, but I already have my CDIP. I'm thinking I've always looked at the CRC, the Risk Coder, Certified Risk Adjustment Coder, which is um, something that's very popular nowadays. That's something that I would look at. The CPMA, Certified Professional in Medical Auditing. I think that's the credential by AAPC as an auditing credential that I would think about. But again, when you think about getting credentials, you have to think about the association that you're going to join. And I just don't like joining two associations. I just want to stick with one and work with the other without getting a membership fee. I like to streamline my stuff, so I have one association, which is AHIMA. Not to say that AAPC is not great. They're great people. They have great associations. They have a great community, and I've worked with them. I've actually been a speaker at their national conference. But the next one that I would probably think about is not a credential. It's more like a designation. It is the AHIMA approved trainer for ICD-10 and PCS. I really want to continue on being an educator, and I figured maybe this trainer designation or license would allow me to do that, to leverage this technology that I'm using here, to help people understand medical coding from all walks of life, from all levels of understanding. I think that would be the best bet. So that is 14 questions that I answered. Hopefully, this helps you out. And I am inviting you to come back to this channel so that way you can kind of give me feedback on the questions that I answered for you. And I wanted a little, get a little bit more about what happened that led to this, and also, where you're at in your school and what are your aspirations in the profession. So that ends this session. Thank you guys for watching this solo mentoring session with me. If you like this mentoring session, please give this video a like. Subscribe to the Medical Coding Geek YouTube channel. Also, check out our podcast, the Not Also Classified podcast on Apple Podcasts. Also, our YouTube channel. Please check that out. And I'll see you guys in the next video.
MedicalCodingGeek.com